Welcome to this.
Just yes, now we can proceed.
Yeah. Okay. Hi, welcome to this unique haircare initiative by IPCA. I'm Mona Sharma. It's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a chronic glory. It makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle-age problem when you used to lose hair of, or have bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring at a younger age. It is not uncommon now to see 25 to 35-year-old people complaining about hair problems. Most of these problems, if identified early, can be managed well, and much of the hair loss can be avoided. Today, we have with us Dr. Vijay. Soyal is a well-known dermatologist and has been practicing over many years now. He is MBBS and he specializes in dermatology, cosmetology, and trichology. Currently, he is practicing at his own clinic, Skin Folic Clinic, Paschim Vihar, New Delhi. Dr. Vijay has dedicated his career to diagnosing and treating a wide range of skin and hair conditions while providing personalized hair care services to his patient. He takes time to listen to his patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Vijay is also aware of the need for the patient awareness about skin care and hair care and spend a lot of time in giving talks at various platforms across the country. Thank you so much, Doctor, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to this YouTube live show.
Thank you, ma'am. Thank you for inviting.
डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया। तो आज हम बात करने वाले हैं हेयर केयर इन करंट सिनेरियो में, और जब भी हम हेयर केयर इन करंट सिनेरियो की बात करते हैं तो सबसे पहला सवाल जो हम सब फील करते हैं इज हेयर फॉल. सो इज हेयर फॉल नॉर्मल?
Ma'am, some hair falling every day is normal, but it should not be like that. We are shedding of the hair should not be too much. Actually, the hair cycle has 3 phases: anagen, catagen, and telogen. So shedding of hair is normal. Telogen phase is for around 15 to 30 days. But if the shedding of hair is too much, it might lead to baldness, which is abnormal. So we should be diligent about how much hair we are losing every day.
Okay, that's very interesting, doctor. So, doctor, when we are losing hair every day, then we get quite confused that like what's normal and when to be concerned for. So, is there any alarm sign or sign and symptoms which we can keep our track on to just know that this is time to visit the doctor?
Yes, there are a few things that we should notice. First of all, the number of hairs that are falling after taking a bath. And apart from that, if there is any thinning of hairs or there is bald patches which are available, or there are gaps in between the hairs. So if that is the case, then we should visit a dermatologist so that we can one should know how much hair is there and what's the cause for it.
Okay, interesting, doctor. So, doctor, like when we are talking about hair fall or hair loss, apart from other medication treatment plan, when nothing works, then sometimes doctors suggest that you can do hair transplant. So, what is hair transplant? Is it like taking the hair from some other person and putting it, or what is it?
Hair transplant is a surgical treatment option for hair fall. If the grade of hair fall exceeds level 3 or level 4, we can go for hair transplant treatment because the medical as well as therapeutic treatment does not lead to new hairs. New hairs can only be grown via hair transplant. What we do in hair transplant is we take out hair from the occipital area of the same person. We take hair from the backside, that is the occipital area, and then we implant it in the crown as well as in the frontal area. So the hairs which are implanted is the person's own hairs. There is nothing which is being transplanted from outside. And if the temporal area does not have a good thickness of hair, we might take hair from beard also.
Okay.
And if the beard is also not there, the number of grafts, then we can take body hairs also. So that is the case. In few cases, when there is no hair available or the patient is not willing to give his hair, we transplant artificial hairs also. That is the fiber.
Okay, interesting, doctor. So, doctor, when we are now that we are talking about hair transplant, people are quite confused कि which is the right doctor, सही doctor कौन सा है, dermatologist के पास जाएं या फिर trichologist के पास जाएं या cosmetologist के पास जाएं. So, which is the right doctor, and when to refer a trichologist or a dermatologist for a hair transplant?
Trichologist and cosmetologist are just fancy terms. There's no
Mhm,
degree as such for a cosmetologist or trichologist.
mhm,
Anybody can presume to be a trichologist or cosmetologist.
mhm,
So if somebody wants to get a hair transplant done, he should be make sure that he's visiting an MD dermatologist or DMB dermatologist, because dermatologist is the degree is verified.
mhm.
So if a person wants to get a hair transplant, then he might get to a dermatologist.
Okay. Okay. So, the dermatologist can help us. So, doctor, with your profound experience, can you please enlighten us today with this platform? Like, is hair transplant safe, or is there any complication after hair transplant? Because people get scared कि पता नहीं कैसा होगा, क्या होगा.
Hair transplant is a daycare surgery. It's very
Mhm,
safe if performed by a proper doctor,
mhm,
because the procedure is very simple. We just ears make slits, then we take out the hairs and implant it. There is no nerve or anything which is going through this area. It's a
mhm,
completely safe procedure.
mhm,
The problem which we see every day now, because the transplant is being done at many centers by technicians who are not diligent to perform the procedures, who did not have any training also.
mhm,
So one should make sure that the what's the experience of the doctor
mhm,
and what's the credentials of the doctor and whether the doctor himself is performing the surgery or not.
mhm,
And patient should make sure that money should not be a factor in choosing the treatment,
mhm.
because the heavy discount offered with the technician, patient sometimes goes to this technician, which might lead to various complications.
Okay. Okay. Interesting, doctor. So, doctor, when we are like talking about hair transplant, and its safety, then does the hair transplant procedure also hurts, or is there any procedural hurting or pain or something like that?
No, no, ma'am. There is no pain as such. It is performed under local anesthesia.
Mhm,
So patient will be very comfortable during the procedure. He might get up also, went to the go to the washroom, room here and there in between.
mhm,
So there's no question of pain during the procedure. There is only just slight heaviness of the head due to the anesthesia that we are given.
mhm. Okay.
Otherwise, there is no pain, no discomfort, nothing.
Okay, interesting, doctor. So, doctor, in this era of information where information is everywhere while traveling, also we'll see poster like people claiming that in 1,000 rupees get your hair back. So, what is the actual cost of hair transplant in India?
But actual cost depends upon the clinic to clinic and the number of hair grafts that the person needs.
Mhm,
Usually, majority of the clinics that are charging, they're charging as per number of grafts that are needed.
mhm,
But as such, there is no fixed amount. Somebody might be performing it for low amount, and somebody might be charging an exuberant amount. It depends on the experience of the doctor,
mhm,
the situation, location of the clinic,
mhm,
as well as the uh, how much patient load is there in the clinic.
mhm,
So there's no fixed amount, but a good clinic performing authentic treatments,
mhm.
the charging might go from 1 to 1.5 lakh.
Okay, okay, yeah, okay. So basically, all those posters are not real, and we should not go there instead of.
Yes, yes. As I told in earlier question also, these are usually performed by technicians who are not trained enough.
Yeah, yeah.
So it's not a good thing, because the graft that are taken, if they don't grow in the area that you need them to grow, your donor is also gone and your graft has also not been able to give you hairs.
Mhm.
So it will be very bad for the patient as such.
Okay, interesting, doctor. So, doctor, then like when we are talking about the clinics, then how to choose a clinic for a hair transplant? Like, what should we look while choosing the clinics?
One should look for the credentials of the doctor who's performing the surgery and
Mhm,
make sure that the doctor who the clinic is claiming that he'll be performing the surgery
mhm,
is there all the time when the surgery is there.
mhm,
And apart from that, the number of years that doctor has performed surgery, one should look for earlier treatment results
Mm-hmm.
How the doctor is doing the surgery and how the results are there.
Mm-hmm.
These are the things that one should look for when choosing a clinic for surgery.
Okay, interesting. So, doctor, uh, while talking about hair transplant, we also think is this is it required to take any pre or post care by the patient? Like, what care should be taken after transplant by the patient to maintain the hair, or is there any like pre preparation for the patient before going for hair transplant?
Pre-preparation is minimal in hair transplant.
Mm-hmm.
One has to get basic blood investigations done so that the surgery can be performed. And after the surgery, one has to get take care of his hairs during 3 to 7 days so that the grafts do not come out. And
Mm-hmm.
apart from that, we usually prescribe medications so that the hair fall of the natural hairs which are there that stops. So one has to make sure that he follow the prescription given by the doctor and
Mm-hmm.
take care of his hair for the initial 7 to 10 days so that the graft that has been implanted does not come out. Apart from that, there's no complicated routine care that is being given to the patient. It's a simple procedure and a simple post care which has been prescribed to the patient.
Okay, interesting. So, doctor, now the favorite part. Can you give us some important tips for healthy hair?
There are a few things that I'd like to point out. First of all, washing hairs regularly. That
Mm-hmm.
is very important because there's a myth right now that if you wash our hairs regularly, it might lead to hair fall. That is completely a myth. Apart from that, avoiding chemical-based products on your hairs. And if there is dandruff or anything oil secretion, one should avoid oil application in the hair. And having a nutritious and healthy diet that also helps in case of hair growth.
Okay, this discussion was very informative, doctor. I'm sure the viewers have found the session very helpful. So, can I take one or two live audience question, please?
Yes, ma'am, please.
Yeah. So, the first question from our audience is, "Hi, doctor. I have grade 3 alopecia and none of the treatment is working on me. Is that means that I have to only go for hair transplant?"
If the treatment is not working on you, it depends on the area of the hair loss.
Mm-hmm.
If there are, it's a clean patch of hair loss, there's a bald patch, then the person might need to go for a hair transplant.
Mm-hmm.
But if the hairs are there and there is just thinning of hairs, when one can choose for other therapies also, such as GFC therapy, exosomes therapy, which provide decent enough results in case of hair loss.
Mm-hmm. Okay, interesting. Another question from our viewer is, "Hi, doctor. My father has a hair loss problem, and his all of the hair has gone, and now he's bald. And at the age of 32, and I'm also losing hair. And does that mean that I will also lose all of my hair? Is it genetic? And I'm also from Delhi. How to get your appointment?"
First of all, talking about whether he lose all his hair, the hair pattern androgenic alopecia that has a genetic component with it. So I can tell this only after looking at the pattern of hair loss.
Mm-hmm.
But yes, there is genetic component in the hair loss, and but it's not necessary that if his father has lost all his hairs, he'll also be losing all his hairs. So he might get it tested by a dermatologist, and for taking an appointment, he can call us on our clinic number or book us appointment online also.
Yeah. Doctor clinic name is Skin Follic Clinic, Paschim Vihan, Delhi. Okay, I'll quickly take one last question from our audience. Hi, doctor. I have diabetes, and can a diabetes patient can also go for hair transplant? Is it normal for them?
Yes, definitely. A diabetic patient can also go for hair transplant as the blood loss or the injury is minimal.
Mhm,
But one has to make sure that the doctor is qualified enough in
mhm,
case of an emergency. Uh, he is okay to control all this if any complication arises. But talking on general terms, hair
mhm.
transplant can be done in case of diabetic patient, unless it is the diabetes is uncontrolled and the level of blood sugar is too high.
Okay, interesting. So, thank you, doctor. And
Thank you,
would
ma'am.
you like to give any take-home message or any other suggestion to our viewers today?
There's only one take-home message. If the hair fall is there, we should not ignore it.
Mhm.
and go to his or her dermatologist as soon as possible.
Thank you so much, Doctor, for sharing all your expertise and answering all the questions of our viewers today. I'm sure the viewers have found this session very helpful. And thank you so much, Doctor. It was a delight to have you. And thank you so much for your valuable time.
Thank you so much.
And also, thank you so much for viewers joining us today and asking questions. If our doctor has some more time in future, we'll bust more myth and fact around hair and skincare. Until then, doctor, please take care of yourself and advance Happy New Year and Merry Christmas.